Hello, my name is Mohit Kaushal and we're doing the first half of the trach care team video. So the first thing we'll be doing is just looking at the physician's orders. And as I can see, for this patient, we have O2 cold pot at humidifier at 45%, suction trach every 6 hours and PRN, change trach dressing, DIC, and ties every shift, ambu bag, suction prior to dressing change, and trach tube cuff, pressure measurements every 8 hours, and then maintain between 20 to 30 millimeters mercury. Okay, so the first thing I'm doing after looking at the physician's orders is going to my patient's room, doing hand hygiene. I'll be bringing my supplies with me, and then upon entering your patient's room, I'll be doing my entry safety check, and then after doing that, I would just be confirming the patient's identity with their armband and their name and date of birth, and once I've done that, I'm going to also be doing a safety check with all the equipment. And as I can see, I have the cold pot hooked up at the correct humidifying level, which is 45%. And then over here, I have my suction equipment. Everything seems to be functioning properly. And then after I've done that, I'm going to be explaining the procedures to the patient. Okay, I have to just I'm Mohit Kaushal. I'm going to be a nurse today, and then I have to also suction you right now, and then I have to change your dressing after. Is that fine with you? Patient has given me consent, and once I've done that, I'm going to start getting my equipment set up. So the first thing I'm going to be doing is pre-oxygenating the patient. So I'll be doing hand hygiene, and then I'm going to be taking off the cold pot. Once I've taken off the cold pot, I'm going to be hooking up the ambu bag to the oxygen.
Oh no, she just wanted to see if they had time to make another. Can we attach a different video?
Oh sure, I'm sure you can. Like this is more about
Okay, I'm turning on the oxygen now.
not about being perfect.
Yeah. Oh, okay, well, yeah.
This is no.
As you can see, this is filling up.
But yeah, like this is more about just.
And now I'm going to be taking this off. And once I put a patient in a semi-Fowler position, it's in a comfortable position for me to suction and change the dressing. And then at hip level, I can start pre-oxygenating the patient. I'm also going to be doing continuous O2 sats just to make sure the patient's O2 sats don't drop below 90. And then so now I'm going to be pre-oxygenating them.
Just make a note. So it's not like this is your first day with the break. So like
making sure to keep in rhythm with their breathing.
practicing is about
3. And then as I can see now, the patient has O2 sats of 100%, so it's good. And then now I can just take off the ambu bag. I can turn off. I'm just going to leave the oxygen on just in case I need to pre-oxygenate them again during the procedure. So I'm going to leave the ambu bag right there. Okay, and then now I've done that. I'm also going to be looking at the size of the trach. So the size of the trach is size 7 trach. So therefore I need to subtract 2, which is going to be 5, and then times it by 2, 10. And then that's going to be the size of my suction catheter. So I'm going to be doing hand hygiene. I'm going to be pulling out my suction catheter. Here I have a size 10 French suction catheter, which is what I'm going to be needing. And also, here I have my sterile water. I'm going to be dipping the tubing in there after just to make sure I can clear the line. And then over here I have my suction. And then so now I'm going to be applying my clean gloves. So now I'm going to be taking out my suction catheter sterilely, making sure to peel it back. Pull it back like this, and making sure to keep the end sterile. I'm going to be getting my suction equipment ready, and then I'm going to be getting my suction equipment, attaching it to here. And now I'm just going to be making sure I put my suction on. So now I'm going to be putting my suction on and turning it on. And therefore now it's suctioning. And now I can grab it about 6 to 8 inches above the catheter tubing, and then I'm going to be making sure I don't put my hand over this little hole by the suction tubing, so therefore I don't suction while I'm going in. And now I'm going to be putting it in. Okay, once I've hit resist, I'm going to go back. I'm going to be doing the spiral motion, intermittently suctioning. And then once I've intermittently suctioned for 10 to 15 seconds, I can pull it out. And if I needed to do another pass, I would do it with a separate suction catheter. And but right now everything seems to be good. And also keeping an eye on the patient's O2 sats, and everything seems to be good still, above 90%, so we're good. And once I've suctioned, I'm gonna be wrapping this within my clean glove, taking this off.
So you just choose.
And once I've wrapped it in a clean glove, I can discard this now.
The instructions on that.
And then now I'm going to be getting my sterile
So
water,
just make sure your names are
opening it up,
and you put either your comments in YouTube.
and I'm also going to be putting my,
Use the document.
I would be putting this in a container, ideally, and I would also just be dipping it in there just to make sure I clear the suction tube, and I also turn the suction off. And then once I've done that, I'm ready to start doing the dressing change.